Kais. Welcome in Physician's Guide to Doctoring.
Hi, Yana. Thanks for having me.
This medical podcast is a practical guide for practicing physicians and other healthcare practitioners who are eager to improve in all aspects of life and practice. Physician and non-physician experts interviewed on a wide range of topics, ranging from emotional intelligence and habit development to social media and the current state of health insurance. Today we have Dr. Kais, senior physiotherapist. Dr. Kais, we are going to talk about low back pain, which is the most common musculoskeletal problem worldwide. 1 to 25 people will change their job because of low back pain or retire early due to disabilities stemming from low back pain. So, why you choose writing about low back pain, Dr. Kais, instead of other issues?
All right. Low back pain is the most common musculoskeletal problem worldwide, and it is leading a cause of activity limitation and absenteeism from work. And it's consequently one of the major global public health problems. And today we are talking about 80% of people are affected by low back pain. But to be honest with you, the reason that makes me wrote about this topic is not because low back pain is the most common health issues. I was inspired to choose this topic due to the lack, or we can say the gap, of these studies, because there has been no clear evidence that one of the exercise program is superior to the another reducing low back pain, and therefore a wide range of exercise have been used for the progressive strengthening of the back and hip muscles, and many previous studies compared various exercise modalities for reducing low back pain. Some of these studies recommended McKinsey, and others recommended yoga. Also, studies conducted by many researchers suggested stabilization exercise. And however, most of the studies found no difference between exercise modalities for reducing low back pain.
Okay. There's evidence from the literature that females have significantly higher low back pain problems than males. Could you tell us why females have significantly higher low back pain problems than males?
Oh, Yana, this is a good question. And also this is logical, as most of the studies in this area showed that females reported more low back pain issues than males. And it has been established that reproductive factors are related to the chronic low back pain, especially in females. And these factors include unbalanced persistent cycle and hysterectomy and also to the best of my knowledge, there is not a single study that concentrated on determining the best and most effective modality exercise for reducing low back pain in females.
Okay. When I read your book, I find that you're focusing on giving exercise treatment more than other treatment that are available in physiotherapy clinics. And the truth is, most individuals are afraid to exercise when their lower back is in pain. They feel like it may worsen if they exercise. The truth is, the appropriate exercise can help elevate low back pain and discomfort. Could you tell us why exercises?
The value of exercise has been accepted as a major strategy in universal guidelines for those involved in the management of severe and chronic low back pain. And the clinical guidelines for staying active suggest advising patients to stay active as possible to continue regular daily activities. And the physiotherapists prescribe exercises for low back pain, but only as a supporting intervention for chronic low back pain patient. And furthermore, results from the literature review indicated that exercise is effective in the treatment of chronic low back pain. It's believed that exercise will be positively reduce pain, strengthen muscle tissue, lower physical stress to the vertebral contractions, and improve levels of fitness, prevent injury, and improve placement and mobility in people with low back pain. And the vast majority of researchers have suggested that exercise as a treatment of low back pain works better than common treatment. So I can say that exercise therapy is highly effective method for relieving chronic low back pain and persistent low back pain.
And what do you advise acupuncture treatment for back pain?
Acupuncture is widely used by patients with low back pain, and although its effectiveness is unclear, new draft guidelines that I have seen issued by the National Institute for Health and Care Excellence covering sciatica and low back pain estimated that don't offer acupuncture for managing non-specific low back pain with or without sciatica. And many people believe that acupuncture has no potential to cause harm, and acupuncture needles can injure vital organs such as lung, spinal cord, and also the major blood vessels or the heart, and they can cause all sorts of infection in the body.
Oh, patients often ask for a magic medication that can cure their pain. It would be wonderful if such medication existed. According to your experience, such a pill does exist?
See, Anna, there is no quick fix for back sufferers. The primary effect of most common muscles relaxants, such as Norflex, to be precise, their effect is on the basic nervous system and the brain rather than directly on the muscles. Cortisone is the strongest anti-inflammatory drugs, but because of their potential side effects, they should be carefully used. These medications may be used for short term, 1 to 2 weeks, and or in some instances, the patient may be kept on this medication for many months. And one common problem with all the potent medication is that they can cause irritation of the stomach and also intestine, and this can result in upset stomach, vomiting, diarrhea, and even bleeding ulcers. I don't intend to scare you, Yana, but exercise, if carried out daily, can control pain in 80 to the 90% of all back problems. Yes.
But there are some patients who continue to have pain even after surgery. What the main reason for that, Dr. Case?
Okay, for the surgery, the reason for post-surgical pain varies. Damage of nerve roots, disc herniation at more than level, and instability between two vertebral bones are all possible causes for persistent pain. And determining the exact cause of discomfort after surgery is difficult. And back operation is not usually successful and frequently leaves the patient worse than before. We can say about 80% of patients with disc problems will get better with time if these patients perform regular daily back exercise, they will never require surgery for their slip discs.
So do you think exercises are enough to protect you from getting back pain?
Honestly, it's not enough. There are some helpful hints in addition to the exercises, which called the proper way to use your back, such as lying down, sitting, standing. The solution in your hands. In that, you must practice good body habits, especially in regard to your back and your posture, lifting and carrying habits are all important. The sooner you learn these good habits, the better your back will be. Even when back problems are caused or related to the stress, exercise can help you in both emotional and physical conditions, and there is no excuse for not doing your exercise. I can guarantee you, Yana, that if you stop exercise, your back will pain or will yes, your back pain will come back and haunt you.
I see. What the relationship between obesity and back pain? Because some of the studies identified a weak correlation. There was insufficient evidence to establish a direct causal relationship between obesity and low back pain.
Yeah, low back pain may not be directly correlated with obesity. It was found that it might be related to the fear, depression, and psychological stress. Obesity is observed as an important factor in the pathogens of low back pain. On the other hand, obesity in isolation could demonstrate no influence, but rather certain types of obesity may be present in people with general poor lifestyle.
Also, in recent years, researchers have uncovered surprising connection between smoking and back pain. In study after study, smokers seem to be more likely than non-smokers to suffer from low back pain. Is there a relationship between smoking and back pain?
Expansion of lumbar spondylosis was significantly associated with smoking history and hypertension, and we can say also high cholesterol. Cigarette smoking could interfere with the blood circulation to the intervertebral disc structures and nerve root, leaving them at risk.
All right. So what about your next book?
My next book, I'm still preparing my next book with another authors, Dr. Wael Gorma from Libya, and he's living in UK, and also Dr. Joyt from UK. The book will be about the practical skills for academic writing, and the most beautiful thing in this book is that authors presented in a style that makes the chapter be justified in more effective ways and easily to be understood by providing some practical examples obtained from previous publishing works. And all of our hopes from writing this book is the readers, after going through all chapters, they would obtain useful and precise knowledge with unique skills about research academic writing.
Very interesting. So thank you, Dr. Faiz, for accepting my invitation to join this medical podcast.
Most welcome there. Thanks so much.
Thank you.